afternoon, everyone. My name is Dr. Darren D. Moore, and I am an assistant professor in the Psychiatry and Behavioral Sciences Department here at Mercer University School of Medicine. Welcome to the webinar, Health Disparities, Obesity and Bariatric Surgery in African American Men. Today what we're going to do is we're going to talk about a research project that I started here at Mercer and talk about how we might think about obesity and specifically bariatric surgery as a possible treatment issue and treatment intervention for African American obese men. Before we get started, I'm going to formally introduce myself, give you a little information about my background, as well as my collaborator, Dr. Davis Smith, who is also a professor here at Mercer University School of Medicine. And then we're going to talk a little bit about the teaching objectives for today's webinar, and then we're going to proceed into getting into the topic. So once again, my name is Dr. Darren D. Moore. I am an assistant professor here in the Psychiatry and Behavioral Sciences Department here at Mercer University School of Medicine. And also my collaborator on this research project is Dr. Davis Smith, Family Medicine Residency Program Director and Associate Professor here in the Department of Family Medicine at Mercer University. Before we get started, I'm going to go ahead and provide some acknowledgments. First and foremost, this project was funded by a 2013-2014 Mercer University School of Medicine Faculty Seed Grant. Okay? So with that being said, I would like to acknowledge and thank our Dean of the Medical School, Dean Bina, Dr. Glasgow, who's also very integral in this process for the Faculty Seed Grants, our interim chair, Dr. Carter, in the Psychiatry and Behavioral Sciences Department. Once again, my collaborator, Dr. Davis Smith, Dr. Steve Livingston, our former program director in the Marriage and Family Therapy Program, and our current interim program director, Dr. Bowden Templeton. And I want to thank all of you for tuning in, for all of you that are here presently, for all of you that are tuning in via social media. I appreciate your willingness to participate in this teaching program. So, formally, I obtained my bachelor's degree in African American Studies from the University of Minnesota. I completed my master's degree in Marriage and Family Therapy at Valdosta State University in Valdosta, Georgia. I completed my PhD in Human Development, Marriage and Family Therapy at Virginia Tech University. I'm a licensed marriage and family therapist, and my research, teaching, and clinical focus includes the systemic examination and assessment of obesity, weight loss, eating disorders, and addictions within the context of couple and family relationships. I have a special interest in working with men, African American families, and other marginalized populations. I'm also interested in exploring men in therapy, African American male identity, men and masculinities, and human sexuality. My collaborator here, Dr. Davis Smith, she obtained her Bachelor of Science from Spelman College in Atlanta, Georgia. Her medical degree is from Wayne State University in Michigan, and she completed her residency at Southwest Georgia Family Practice Residency Program at Phoebe Putney Hospital in Albany, Georgia. And her research interests include diabetes, obesity interventions, health disparities, obesity and faith-based interventions, and family practice. Okay, so let's move on. Let's talk about the teaching objectives for today. Number one, to inform the community about a research project titled Health Disparities, Obesity and Bariatric Surgery Among African American Men. To encourage medical professionals, mental health professionals, and individuals from the community to think critically about the topic of obesity, specifically for African American men. To explore the topic of health disparities among African American men as it relates to obesity and bariatric surgery. To further the discussion of ways we might think about obesity treatment, intervention, and research for the targeted population. So, our essential question for today is, what are the barriers to obtaining bariatric surgery for African American men? So let's start off with some introduction. One of the things I think comes from being an African American obese male is obesity is kind of brushed under the rug a little bit. A fair amount of males in the black community are obese because of the way we eat and the way we have been trained. And then if you are eating, you must be in good spirits. So if you are eating, you are happy. And people always want to make you happy. There's not a lot of emphasis put on losing weight and portion control and all that good stuff. Because people confuse choosing happiness and being fulfilled as far as food is concerned over health. So as an African American male, that's something that's kind of the foundation of how I grew up. Everybody fed me. Everybody wanted me to be happy. Once I got to a certain stage where I actually started putting on weight, it was kind of hard to break that cycle. And this is coming from one of the participants in the research study, Jacob, age 33. Two additional excerpts. Masculinity. Bariatric surgery, something feminine. Like, hey, I'm a man. I don't need any cosmetic surgery or something that can help me lose weight when I can do it by myself. That's from John Withers, age 26, another participant in the study. African American males in general are not really that informed on health issues anyway. They tend not to go to the doctor as much as others, and they tend to be more afraid of the hospital or particularly working with the medical health personnel. I think it is more hard for them to get the information because they're already afraid of hospitals and doctors and health and whatnot. And that's coming from Pat, age 30. So let's talk a little bit more in depth about obesity as an intervention, as an issue among African American men. All right, we're going to go ahead and get started in a discussion of the literature review. Okay? So some of the key terms for today: obesity, African American, health disparities in African American men. So my first question to you all: what is obesity? So obesity is a complex phenomenon. Okay? There are many ways to think about, to conceptualize, to make sense of this thing, this issue, this problem, this epidemic we call obesity. For some individuals, obesity is an epidemic. For some, they consider it a disease. Others might view it as a social or a moral problem. Some individuals may even consider it a religious issue or concern. For some, it's a cultural issue. Others, it may be a mental health issue. For some, it could be related to an eating disorder, right? For some, it's strictly looking at a person's body weight and having excess body weight, okay? So one of the ways that we think about or we decide to measure obesity is through BMI, or body mass index. As we know, body mass index is not the best way to define or to assess for a person's obesity status, but what we do know is that it's the most universally utilized way to do it. And so, in terms of obesity, an individual with a body mass index of 30 or higher would fit in that category. So, I'm just going to give you a couple of statistics on obesity. I know that you all are aware that obesity is an issue. This is why you've decided to tune in. It impacts individuals, couples, and families here in America, abroad. It does not discriminate, right? Obesity is a public health phenomenon. In 1990, 1 out of 5 U.S. adults were found to be at least 20% overweight. Currently, as in 2010, 1 in 3 American adults are considered obese. Now that's a lot. The South has the highest obesity prevalence, 29.4%, followed by the Midwest, the Northeast, and then the West. So here in Georgia, we are definitely at risk. 58 million Americans are currently overweight. 8 out of 10 people over 25 years are overweight. 78% of Americans are not meeting basic activity level recommendations. And so you'll see there's some other statistics here available, but essentially what I'm trying to convey is that obesity is an issue that we must think about in terms of how do we address this within our friends, our families, and our communities. While obesity does impact individuals from all backgrounds, regardless of race, socioeconomic status, or gender, or religious background, or disability status, what we do know is that there is a disparity in terms of the obesity rates when you think about African Americans when compared to their Caucasian counterparts. So, non-Hispanic blacks or African Americans have the highest rates of obesity. Compared with Mexican Americans, all Hispanics, and non-Hispanic whites or Caucasians. Okay, so yes, obesity impacts everyone, but there is a disparity in terms of the rates of obesity. So what we're going to be talking about is disparity, not only in the rates of obesity when you think about African Americans when compared to Caucasians, but specifically looking at gender in African American men. We're also going to talk about disparity as it relates to access to health care as we think about bariatric surgery. One of the things that I wanted to make clear today is that I am not for or against bariatric surgery as an intervention to address the obesity epidemic. I am for health. I am against disparity. What we do know is that while there are a variety of treatment interventions and perspectives to address the obesity epidemic, as it relates specifically to morbid obesity, bariatric surgery has been found to be the most effective treatment. With that being said, we have to think about how that can compare as we look at the numbers and compare the disparity as it relates to African Americans and African American men in particular and Caucasians as it relates to the percentages of individuals who actually undergo bariatric surgery. So some of the contextual factors that we always have to be thinking about when we're talking about individuals, couples, and families, we always have to be thinking about, yes, people are people, but people are people within the context of systems, right? Within the context of race, of class, of gender, of socioeconomic status, disability status. So we have to always be thinking about culture, the cultural context that people are embedded in, okay? So, I'm sure you all know there are a number of medical issues related to obesity, right? So, here we are, diabetes. How many of you have dealt with issues of diabetes or know someone that's dealt with issues related to diabetes? Okay. High blood pressure, hypertension, heart disease, stroke, obstructive sleep apnea, certain cancers, death, etc. So obesity has a negative impact on an individual's health. In addition to medical issues associated with obesity, we must think about the mental health aspects related to obesity. So specifically, we're talking about eating disorders, whether we're looking at eating disorders not otherwise specified, or now with the new DSM, binge eating disorder as its own unique entity and diagnosis. There's some discussion around food compulsion or food addictions, so to speak. There's a lot of discussion around depression within the context of obese individuals. as well as low self-esteem and negative self-worth. So, obesity among African American men. Men may have unique experiences as it relates to the obesity epidemic. Specifically, as they think about health, male identity, self-esteem, and men's relationships. Of course, obesity impacts the African American female as well. In many ways, African American women have the highest rates of being overweight or obese compared to other groups in the U.S. About 4 out of 5 African American women are overweight or obese. African American women are a very important group of people to study, to think about obesity and how we might address the issue. However, one of the problems is most of the research that is conducted regarding obesity among African American populations are focused on African American women. So we have to think about the experiences and the perspectives and the attitudes of African American men. Of course, I cannot talk about African American men and African American women without talking about children. So, as we also know, obesity negatively impacts African American children, and there are also disparities as it relates to African American children and their rates of, or the prevalence of obesity when compared to Caucasian counterparts. So, I'm going to talk a little bit about some theoretical perspectives. This is something that I think it's important for us to think about at least. So there are some historical aspects of obesity. There are some researchers who have discussed and explored the legacy of the enslavement period on the African American culture and the African American behavior. And so there are some individuals who support the notion that the African diaspora has transferred cultural, agricultural, and dietary practices from Africa to the New World. Okay? There is something called the slavery hypothesis, which talks about how hypertension was projected onto African Americans through the period of enslavement. There's another theory called the historical trauma theory, which actually emerged out of the Holocaust experience. There's some researchers who suggest that groups of people that experience mass trauma, historical trauma, can be impacted for multiple generations to come. Okay? So the theory behind this is that the period of enslavement may have been experienced in such a way that it could have impacted individuals' attitudes, perspectives, and behaviors towards food and exercise. Related to that is a kind of new pop culture phenomenon titled post-traumatic slave syndrome. It is, of course, a play on PTSD, and it's another perspective of thinking about how African American individuals have been the victims of trauma and how that can impact a person in terms of how they cope or not cope with their issues, problems, or concerns. This is just to give you a little perspective regarding some of the theoretical approaches to thinking about obesity within the African American culture. So, of course, individuals within the context of couples and families. So obesity not only impacts every part of the family system individually, but it impacts the family as a whole. So within the African American community, we're talking about cultural aspects of obesity, attitudes towards food, socioeconomic status. Do people live in a neighborhood where they have access to healthcare and healthy food? We talk about disparities in terms of access to health and disparities in terms of access to healthy foods. We also have to think about obesity within the context of dominant notions of beauty. So what is considered acceptable or beautiful in one culture may be different in other cultures, right? So we have to think about that as it relates to how we perceive ourselves as it relates to body mass index. We also have to think about obesity and religion. That's another topic that we don't always talk about. However, the research suggests that there is a positive correlation among individuals who attend church and higher levels of body mass index. Likewise, there's a discussion around negative advertising focused on lower socioeconomic status, disenfranchised, marginalized African Americans and other races and ethnicities that could also impact an individual or a couple or a family's obesity status. So now we're going to talk specifically around some research on obese individuals. So as we know, obese individuals may deal with issues related to social stigma. Obese individuals may be subject to public ridicule, weight biasness, weight-based discrimination, and stigmatization. Okay? We also know that individuals may experience issues and or conflict within their couple relationships. Specifically for African American men, there may be issues related to infertility, reports of less sexual excitement, avoidance of sexual encounters, lower sexual activity, and less satisfaction with their sexual lives. Right? Erectile dysfunction. In terms of motivations for weight loss, the research suggests that most obese individuals indicate health as the primary reason for focusing in on weight loss. After health, it's physical appearance. So physical appearance is important to some people. Family and relationships. All right, so now we're going to talk a little bit about obesity treatment. So as I mentioned earlier, there are a variety of treatment modalities that have been utilized to address the obesity epidemic. So some of them include an individual's personal attempts to lose weight, right? Diet, exercise, etc. Now there's online and internet social support for individuals. So you hear lots and lots about people engaging in social interaction on social media and encouraging one another, whether they're posting videos of themselves losing weight, exercising, whether they're engaging in instant messaging. The internet has been utilized to address the obesity epidemic. Of course, there are physician-supervised diets, right, such as low-calorie diets, very low-calorie diets, low-carbohydrate diets, etc. There's behavior modification or mental health treatment, and then there's bariatric surgery. So as I mentioned before, as it relates to morbid obesity, bariatric surgery has been viewed as the #1 most effective treatment. So we have to think about African Americans as it relates to this topic. So we also know that there are a number of global or universal initiatives that individuals in the larger dominant society have started to really focus in on addressing the obesity epidemic, such as Michelle Obama's Let's Move campaign. Surgeon General of the United States, Regina Benjamin, has a focus on working to improve the obesity epidemic, and lots of other, once again, national and local initiatives to address the obesity epidemic. However, obesity is still an epidemic. It's still an issue, it's still a problem, it's still a concern that we really must think about and focus in on. Despite the intense level of attention directed towards obesity, there has been limited success in addressing the rising rates of this public health phenomenon. Bariatric surgery has been shown to be the #1 effective treatment. It was once viewed as an extreme measure many years ago. However, with new innovative treatments, more individuals, more men and women, and even some teens are starting to utilize this as a treatment method. So, let's talk a little bit about health disparities. When one compares the individuals who are eligible for bariatric surgery to individuals who actually obtain bariatric surgery, significant disparities exist and intersect across both race/ethnicity and gender. For example, one study found that African Americans are less likely to obtain bariatric surgery when compared to Caucasian counterparts. Men are less likely to obtain surgery when compared to their female counterparts. Okay? Once again, another study found that less than 0.5% of the 22 million people in the US who are medically eligible for bariatric surgery actually get the surgery. And those who do are most likely to be Caucasian females with higher incomes and who are covered by private health insurance. That's something to think about. Likewise, several researchers have found that women constitute 85% of bariatric surgery patients, whereas men constitute the remaining 15%. So even outside of the context of race, we have to think a little more in depth about why there's a disparity as it relates to men versus women who obtain weight loss surgery. Once again, researchers have suggested that while obesity rates disproportionately, i.e. disparity, impact the African American population, African Americans are less likely to obtain bariatric surgery when compared to Caucasians. Some of the issues that are prevalent in the research include researchers have not substantially explored barriers as to why disparity exists outside of socioeconomic status. So if you go and do a literature search and explore the literature on health disparities as it relates to obesity among African Americans and specifically obesity treatment, most of what you will find is specifically focused on socioeconomic status. While I think that's important, and I definitely understand that perspective, I also wonder, are there any other aspects beyond socioeconomic status that may play a role in this disparity? There's a lack of discussion regarding the beliefs, the attitudes, and the experiences of African Americans, and specifically African American men, regarding obesity and bariatric surgery. So number one, the research is focused on Caucasians. The research is focused on female patients. In essence, African American men have been marginalized in the research and clinical settings regarding this phenomenon. With the increasing rates of obesity impacting African American men, we have to think about how do we address this issue. All right, so now we're going to transition in to talking about the specific research study that I conducted along with Dr. Davis Smith. So the purpose of the research study was to explore health disparities regarding obesity and bariatric surgery among African American men. The researchers were specifically interested in exploring the barriers to obtaining weight loss surgery. Okay? The researchers examined the phenomenon by exploring the experiences and perspectives of obese African American men who qualify for bariatric surgery based on body mass index, but who have chosen, for whatever reason, not to consider that as a treatment modality. To provide information that could be utilized to help scholars better understand health disparities for this treatment population. And also to inform how scholars think about bariatric surgery as a treatment method regarding obesity for African American men. So the research questions include, what are the barriers to obtaining bariatric surgery for African American men? Some of the sub-questions include what barriers currently exist for African American men as it relates to obtaining bariatric surgery. What are African American obese males' perspectives regarding bariatric surgery as a treatment for obesity? And what does it mean to be an African American male who undergoes bariatric surgery? So, in terms of recruitment, I targeted African American men who met the BMI criteria for bariatric surgery, but who have not undergone bariatric surgery. So let me talk a little bit about the qualifications for bariatric surgery. So typically, according to the research, a person is viewed as a good candidate for bariatric surgery if they have a body mass index of 40 or higher, or 35 or higher with a comorbidity. However, those cutoff rates are actually being less adhered to. There's more discussion around providing weight loss surgical intervention depending on the specific modality. If we're talking about the gastric bypass or laparoscopic banding, there are some individuals under a 35 body mass index that have undergone weight loss surgery intervention. In addition, body mass index is not necessarily always adhered to here in the US. In addition, for some individuals, according to the research, if a person is not allowed to have weight loss surgery, but they're interested, they can fly to another country that may not have the same body mass index perspectives and undergo weight loss surgery. So in the literature, there's a discussion around what's called medical tourism, that some individuals actually leave the United States and go over to South America and other places to undergo weight loss surgery, as well as other cosmetic surgical interventions. Due to the disparities among African American men in bariatric surgery, the researcher utilized a variety of mechanisms to obtain participants. So I looked for participants here in the state of Georgia, right? I looked for participants in Alabama. I looked for participants in my hometown, which is Minneapolis, Minnesota, St. Paul, Minnesota, via traditional recruitment methods. So I actually created flyers, passed them out, connected with hospital administrators, local community agencies to disseminate information about the research study. Likewise, I utilized online approaches. So I provided information about my research study on social media, including Facebook, YouTube, Instagram, Twitter, and other platforms. And I also utilized snowball sampling. So if I had an individual that met the criteria for the study, if they knew another person that may have met the criteria, they would, of course, refer them. So once again, eligibility for this research study includes identify or self-report as an African American male, significantly overweight, right? Actually met a body mass index for obesity status, has not undergone bariatric surgery, and does not plan to undergo bariatric surgery. So, the methodological approach. As we know, as researchers, as scholars, you have to start off with your research question. And for my research question, I really was interested in gaining an in-depth description about the phenomenon of obesity among African American men. I wanted to inquire about how they think about, how they make sense of weight loss surgery, and to find out information that could inform the issue around health disparities related to this topic. So quite naturally, I utilized a qualitative approach, specifically phenomenology. Those engaged in phenomenological research focus in depth on the meaning of a particular aspect of experience. assuming that through dialogue and reflection, the quintessential meaning will be revealed. So with that being said, there was a dialogue that took place between myself and my research participants. So within qualitative research, the researcher is the instrument, okay? One of the things that's very important in qualitative research is researcher stance and reflexivity, okay? So reflexivity, the process whereby researchers report on personal beliefs, values, and biases that shape their inquiry. So as I think about this topic, it's important for me to consider, what are my personal perspectives? What are my own ideas, right? And how do I make those transparent as I'm navigating through this research process, right? Reflexivity included documenting my own thoughts, my beliefs, my assumptions, my epistemology, right? And my positionality in relation to the research question and the phenomenon. So once again, reflexivity works to reveal biases that may impact and or impede on the research process. Provides a frame of reference regarding how the researcher is approaching the study. Researcher stance and reflexivity is also critical as it demonstrates academic rigor within qualitative research. So for me to think about doing research on African American obese men and not consider that I'm an African American male, that I've had experiences with obesity, it would be important for me to make those ideas transparent. So, yes, I have experienced my own perspectives around obesity. I have not undergone weight loss surgical intervention, but I have experienced what it's like to be an obese African American male. And I do have my own ideas and my perspectives regarding the meaning of bariatric surgery. So I made those transparent in my research process by reflecting on my own personal experiences and how I approach the study. So, I'm going to talk about the methodological approach. I did 60 to 90 minute semi-structured interviews. So I talked earlier about this dialogue, right? So I met with individuals, and these interviews took place over the phone, consisted of a series of questions developed to explore the experiences and perspectives of obese African American men. The interviews were transcribed, right? So within qualitative research, if you're doing an interview, you have to transcribe the data. So the interviews were transcribed, and they have been analyzed to look for themes that emerge within the research. The interviews were transcribed and are currently being coded, utilizing a team of research consultants. So with this research project, one of my interests is to connect with students. So I'm also working with 2 students in the medical school on this project as it relates to coding the transcripts to look for themes. So this involves becoming immersed in the data, right? Reading the interviews multiple times and making notes in the margins. So I reflected on the content and that provided a rich description regarding the phenomenon. Currently assigning codes to bodies of text within interviews and developing themes. All right, thank you for joining with us. We're now going to talk about the results of this study. So, I completed 15 interviews, and once again, these interviews were 60 to 90 minutes, and they took place over the phone. So in terms of the location of the individuals that participated, there were 8 individuals from the Midwest, 6 individuals from the South region, and 1 person from the West Coast. The average age of the participants was 37, The average height, 5'10", average weight, 285 pounds. So that average body mass index was 42, class 3, severely obese. The average income for the participants was $31,000. 4 of the participants identified as non-religious or spiritual, while the remaining 11 self-identified as Christian. 9 reported relationship status as single, with the remaining 6 reporting being in a relationship. Okay? 11 reported having children. In terms of education, 1 of the participants in the study had a PhD, 3 individuals had a master's degree, 3 individuals had a bachelor's degree, and 8 individuals had at least a high school diploma. So, in the interviews, I asked the participants about some of the health concerns that they have. Physical health issues, asthma, hypertension, back pain, kidney disease, numbness in legs, enlarged prostate, type 2 diabetes, high cholesterol, seizures, migraines, hip issues, among others. In terms of mental health, some of the individuals talked about ADD, ADHD, bipolar, and panic attacks. So this just gives you an idea of some of the issues that individuals may present with. So some of the findings. So once again, these are the preliminary things. So I'm still going through this data and still thinking about and conceptualizing my theoretical model, but there are a number of preliminary themes. The first major theme is lack of discussion. One of the things that I found extremely interesting in this research is that most of the participants talked about there has been a lack of discussion regarding bariatric surgery as a treatment modality, specifically by their physicians. So what the participants talked about, I asked them, has your physician ever mentioned to you bariatric surgery as an option for obesity? Have they ever approached you about bariatric surgery? Has that ever come up in a discussion regarding obesity? And the most dominant answer was no. In addition, in terms of lack of discussion, the participants talked about there being a lack of discussion regarding obesity and bariatric surgery in general, within the context of individuals' own personal lives, their own families. No one's talking about bariatric surgery. Lack of education. In the research study, I asked individuals not only about what they think about obesity and what they think about bariatric surgery, I also asked them to define it. So I asked individuals directly, well, what is obesity? Right? In addition, I asked participants, do you consider yourself to be obese? Interestingly enough, there were a number of individuals who, based on body mass index, would qualify and would be reported as obese. They did not feel that they were obese. They did not consider themselves to be obese. Okay? Obesity is not a threat. So a lot of individuals in the study, most of the individuals, talked about obesity is not really a threat. Obesity is an issue, it's a problem, but it's not really a big deal. Right? And so when I asked them to define obesity, they talked about, well, obesity just means I'm normal. Everyone else in my family is obese, or in my community. Right? So obesity wasn't perceived as a threat or an issue. Now, moving on to the next theme, bariatric surgery as a last attempt. So when I asked participants, would you ever consider bariatric surgery? Would you ever think about it? Individuals reported bariatric surgery will be a last attempt. I have to be on my deathbed in order for me to consider bariatric surgery as an intervention. Number 5 was kind of a newly emerged theme. It's related to theme 2 of lack of education, and theme 3, obesity not a threat, is I'm not obese. So according to body mass index, I may have a body mass index that's 40 or higher. And on paper, I may qualify for bariatric surgery. Or I may have a body mass index of 35 or higher with a comorbidity. So I qualify for bariatric surgery, but I may not view myself as obese. I may not consider obesity to be a problem, and so that might impact how I think about bariatric surgery as an intervention. So I'm going to talk a little bit more about what do these themes really mean. So I'm going to actually fast forward a couple of slides and get into a more in-depth discussion. All right, we're going to go ahead and move to the discussion section. This is the second to the last section, so we'll go ahead and talk about more in-depth discussion regarding the results. And then I'll take some time to talk a little bit more about obesity in general and bariatric surgery in general as it relates to African American men. So, in terms of the discussion, the preliminary results suggest that potential barriers include dominant perceptions of bariatric surgery, cultural perspectives, as well as dominant notions of masculinity. So one of the things that came up was, as you remember in the very beginning of the webinar, I utilized a quote that talked about, well, bariatric surgery is feminine. It's for women. So that was one of the themes that also emerged, is that bariatric surgery is for females. Men are strong. They are to address their own issues without asking for help. Okay? So we have to think about gender. And that also may help inform why it is that 85% of bariatric patients are female. Perhaps. That's one theoretical perspective. While financial resources were assessed among the participants, it was not reported as a significant barrier to weight loss surgical intervention. So when I asked about what are the barriers, some of the participants talked about socioeconomic status, but they did not focus on that as the sole issue. They talked more about how they think about obesity and how they think about bariatric surgery. Well, if obesity is not a threat, then why would I consider having a surgical intervention? Right? So we have to think about that as we try to figure out creative and innovative ways to address this issue. Most of the literature regarding health disparities has suggested that a lack of financial resources is the main barrier to weight loss surgical intervention. However, the results indicate that there may be additional barriers as it relates to culture and gender. So, some of the questions that I have as I currently and continually go through the research and continue to review the transcripts. Why are physicians not discussing bariatric surgery as a possible option with African American men? How could physicians and other medical professionals broach the topic of bariatric surgery? Now, of course, one of the things that I did not ask is how frequently do you attend the doctor's office? So, in theory, that could be an issue. If African American men are not going to the hospital, then that could be a part of the reason why there's a lack of discussion. However, there are African American men who do visit the doctor, and there appears to still be a lack of discussion regarding bariatric surgery for an individual that, based on BMI, would qualify for surgical intervention. So I also wonder, how can we improve in the area of disseminating health education, including the topic of bariatric surgery, as an option for obesity, specifically for African American men? So how do we communicate with the larger society? How do we help inform this is what bariatric surgery is? it's not a surgical intervention that is just for females. It is a possibility for an individual that has a body mass index of 40 or higher, or 35 or higher with a BMI of 35 or higher with a comorbidity, and increasingly even lower than a BMI of 35. How do we address issues related to culture and gender regarding obesity among African American men? What role does non-surgical intervention have for obese African American men? So in this study, I did ask participants, have you ever attempted to lose weight on your own? And if so, what did you do? And was it effective? There were a couple of individuals that talked about how they did their own diet and exercise program, and that they were successfully able to lose weight. However, they talked about how life happens. People experience stress, and sometimes people don't continue their lifestyle changes. So I just wonder if men, specifically African American men, are thinking about bariatric surgery as an intervention for females. How else can we address this issue? How can we challenge those assumptions? How might we use the information gathered in this research to think about ways to intervene with African American obese men? Is surgery a viable option? Could surgery be a viable option? If we change the way that we think about it, if we challenge people's assumptions, could it be a possible option? These are just some things I really want you to think about. Once again, I'm not for or against bariatric surgery. I'm for health. Whatever it is that you need to do, or that people need to do to create healthy lifestyles. Once again, I think there needs to be a discussion about what is healthy. Because if I am a person that has a body mass index that would put me in the obese category, but I myself don't conceptualize myself as obese, there's a discrepancy there that I think needs to be addressed. So these are just some things that I want you to really think about as you go on in your everyday lives, as you interact with people, as you think about how do we tackle this issue. For some of you who are researchers and scholars within the academic world, for some of you who have called in or have tuned in via social media, who may be dealing with obesity issues yourselves, for clinicians who might work with obese populations, medical professionals, we still need to address this issue. We still need to create additional research in this area. So I just want you to think about how might we utilize some of the research that has been conducted to improve and to add to the discussion, and think about more creative ways to address the obesity issue. So some additional questions: what can we do to address the obesity issue in the African American community, specifically for African American men? What can we do? How can we as educators introduce and integrate discussions around obesity and health and wellness within our classes here at Mercer University and our classes everywhere else in the U.S., whether you teach at the post-secondary level or even in grade school, middle school, high school? How do we think about, how do we broach these topics? How might the community create opportunities to address obesity among African American men? Yes, there are interventions, but there's still an issue. What kinds of research questions could individuals in academia consider exploring? Are there clinical or mental health interventions that can be implemented specifically for the African American community, and even more so for African American men? So, with the results of this study, my myself, along with Dr. Davis Smith, will be conducting a second research study to build on the platform of this first study. Okay? So the first study, as I just discussed, was qualitatively based. It was more focused on gaining a rich description of the phenomenon of obesity, and specifically attitudes and perceptions regarding bariatric surgery as a weight loss surgery intervention for obesity. However, the second study, I will be utilizing a quantitative perspective and methodological approach. So I will be, of course, increasing sample size, utilizing a nationally represented sample, and I will be utilizing some valid instruments to assess for African American obese and non-obese African American males' perspectives regarding obesity and bariatric surgery as a weight loss surgical intervention. And so I will be conducting a study within the next few months to focus on how do we build on what we've learned today. One of the things in closing, I want to find out if there are any questions that anyone may have specifically related to this research or regarding obesity within the African American community and obesity among African American men that you may want to pose, that we may want to discuss. All right, thank you all for joining us back. We're at our last section, which is just a Q&A. As I mentioned before the break, I asked if there were any questions that any of you that are here presently or via social media have regarding the research topic specifically, or just around the topic of obesity as it relates to the African American community and African American men. And so I've received a number of questions. I'm just going to go through a couple of them. There were actually a couple of individuals who asked a similar question. And so I want to read to you a couple of these questions. So the first question, this is by Kendrick Dyer, licensed clinical social worker at Moody Air Force Base, as well as instructor at Valdosta State University in the African American Studies Department, as well as the social work program. And he says, has anyone noticed any issues with decreased sex drive? Are men taking any medications such as Viagra to assist with increasing sexual performance? Okay? So I'm going to add a couple of questions that were related to this, because we're really talking about couples, right? Dr. Bellows, who is an assistant professor in the Psychiatry and Behavioral Sciences Department here at Mercer University School of Medicine, he's participating via social media as he's at the Atlanta campus of Mercer. He asked, how do men's communities support systems react to African American men who have weight loss surgery? Ms. Angela Kimbrough, PhD candidate, ABD, and therapist for Community Solutions in Columbus, Georgia, asked, do African American men who have weight loss surgery experience problems in their relationship with their significant others due to the drastic weight loss or new image? Likewise, Ms. Angela Huckleby, nursing student from St. Paul, Minnesota, asks, how might African American men think about their relationships, and how might their relationships be affected after weight loss surgery? So I'm going to talk about that, and then I'll follow up with maybe one or two other questions, and then we'll conclude the webinar. So going back to the first part by Mr. Dyer, increased or decreased sex drive. So as we talked about earlier today, there are issues around infertility and erectile dysfunction. And so obesity does impact an individual's sex desires and sexual behaviors. After after surgery, some of the research suggests improvements in sexual intimacy and sexual satisfaction within the context of couple relationships. Now, I have read in the literature that sometimes what can happen is that while a male's libido, so to speak, may improve or increase, that may not be widely viewed as acceptable by their counterpart. So if you think about one person who has an increase in libido and another person that doesn't have that same increase, those two individuals may no longer be compatible sexually. One person may decide or be interested in having sexual interaction more frequently than before. So that can impact a couple and how a couple transitions through this weight loss process. In terms of Viagra, I'm really not sure if that is something that's utilized through this process. I do know that it does impact sexual intimacy, and so it could be that that might be a viable option. Specifically as it relates to Dr. Bellows, communities and support systems as it relates to the reaction to individuals who undergo weight loss surgery. Well, it really depends. Some people are supportive. In this specific study, I asked individuals to imagine if they were going to have surgical intervention. And I asked individuals, if you were to have surgery, who would play a role in your decision-making process? Would your spouse play a role? Would your family play a role? Would your coworkers play a role? Would they be supportive? Would they not be supportive? And I actually got mixed results. Some individuals talked about, yeah, I think my family would be supportive because they know that I'm doing what I need to do to be healthy, to stay around for my family. So that was one perspective that you saw in the research. Another perspective was, well, bariatric surgery is taking the easy way out. And so some individuals talked about how they have been a part of conversations themselves, or they have heard about other conversations where people frown upon individuals who may utilize bariatric surgery as an intervention for obesity. So there's a notion that it's taking the easy way out, that a person's lazy. So it goes back to this idea or this concept that obese individuals may have a moral issue or problem. And so in that regard, some family, some friends, some coworkers may actually frown upon and not be supportive. Now, I conducted some research regarding the impact of weight loss on couples. And one of the things that I found in a previous study is that a spouse could resent the other person for losing weight, especially if that throws off the equilibrium or homeostasis within the family system. So if you have a couple that is used to operating a certain way, for example, they're used to going out to eat to certain restaurants or eating certain types of foods, when you have a person that has undergone such a drastic measure, their whole attitude may change towards food. They may no longer be interested or concerned with going out to eat at certain restaurants. Their menu or their diet may change. They may desire other foods. And so if a couple initially bonded over food, which lots of couples and families do, especially when food is such an integral part of our lives, whether you're talking about just family dinner, Sunday dinner, church dinner, Thanksgiving dinner, graduation dinner, that may pose as a problem and create some friction within a couple relationship. Moving on down a little bit, I want to pose a question by Mr. Derek Carter, who is an employee of Valdosta State University, And he asks, is obesity caused by stress or by food intake? I think that's a pretty interesting question. And to be quite honest, I think it depends. Right? It depends on the individual, what type of stress they may be experiencing, what their diet looks like. As we think about obesity, as we go back to the initial slide that I talked about, obesity is a complex phenomenon. So, yeah, diet may be involved, stress, genetic predisposition, culture, gender. There's so many different aspects that could impact a person's obesity status. So, it could be caused by stress. It could be caused by food intake. It could be caused by other things, but probably a combination of all of the above. I think we have one final question, and this is from Mr. Willie Campbell, who is tuning in from Virginia. He says a really interesting question. Why are obese African American men shied away from in the workplace? That is a very interesting question. I'm not sure that I know the answer to that. But going back to our discussion about weight-based stigma and discrimination, we do know that individuals that are considered obese do suffer in the workplace as it relates to promotions, as it relates to perceptions. One of the things that dominates the literature is that there is this perceived weakness of obese individuals. If you are obese, then you're lazy. Well, then why would I want a lazy person to work for my corporation, my business that I'm trying to create or develop? The idea that a person lacks discipline. So if you're not disciplined over your own life, how can I expect you to be disciplined in the workplace? Now, some of the other discussions around obesity in the workplace are related to the cost of healthcare. So when we think about obese individuals, now this is true, that obese individuals take in more sick days from work. Also, we have to think about the cost of healthcare due to obesity and related conditions. So that's another aspect of this discussion around obesity and weight-based discrimination and stigma. I definitely believe that it is wrong, but that might be a part of this discussion around why African American men, obese men, might be viewed negatively by the workplace. Let's see. I think that was the last question, and I just want to thank all of you for participating in this webinar. I hope that you learned some information that you think is helpful as you think about the topic of obesity. I hope you've learned something about obesity specifically as it relates to African American men. And I hope that there is something that you can take away from this study that can help you as you think about working with other people or improving your own personal lives. Once again, I want to thank all the individuals that participated here, live, and also via social media for participating in this webinar. Once again, I want to thank a couple of individuals for supporting me in this study. Once again, this study was funded by a 2013-2014 Mercer University Faculty Seed Grant. And I want to acknowledge and say thank you to Dean Bina, to Dr. Glasgow, Dr. Carter, Dr. Davis-Smith, Dr. Livingston, Dr. Templeton, and Mercer University School of Medicine. Once again, I would like to thank you all for participating in this program, in this webinar. I hope that it provided some informative information that could be utilized to address the issue of obesity within our community. Once again, I am Dr. Darren D. Moore, Assistant Professor in the Psychiatry and Behavioral Sciences Department at Mercer University School of Medicine. My email is moore_dd@mercer.edu. Likewise, I am on Facebook, Twitter, YouTube, and you can also contact me at my personal website. Thank you once again. Stick around. There's more to come.